Hi, I'm Stephanie.
And I'm Justy.
And together we're losing it.
We both lost over 100 pounds by developing healthy habits.
And I also had weight loss surgery and used a GLP-1 medication.
And I used a GLP-1 medication and had skin removal surgery.
We're really passionate about helping people learn to live a healthy lifestyle by sharing our experiences.
But we're not doctors, so if you have questions, reach out to your medical team. And you may see our mascot Sancho pop up from time to time.
And all three of us hope that you find our content useful.
Hello, friends. Today we have a guest, and we have Miss Summer with us. And Summer actually is the woman who's been doing my lymphatic massages after my second round of skin removal surgery. And when chatting with her, she's just so smart. And so I was like, oh my gosh, she has a book, she has a podcast. So I was like, you have to come on our podcast and just give our listeners some of your knowledge. And I think it would be super helpful. So I'm going to kick it over to Summer and just have her introduce herself and let us know kind of how she got to this, doing this as a profession. And then we can get into some fun questions that we have.
Oh, yes. Thank you for having me. My name is Summer Maiden, licensed massage therapist. I've been a therapist since 2006, and I actually started doing lymphatic drainage in 2006. I started working within a hospital, a local hospital that I was employed with, doing inpatient therapy. So I worked on oncology, hematology oncology, heart-lung transplant team, cardiac and pulmonary, and then the rehabilitation. So doing that after people were having surgeries or dealing with different type of pain management and cancer, I was able to do lymphatic drainage to kind of keep the swelling down. So that's kind of how I got started with that and be able to help with any stagnation. And then as over time moving on, I ended up working with more plastic surgery after people were kind of looking for who can do lymphatic drainage. So I work with some plastic surgeons here in Charlotte, North Carolina. And I have a few that still refer to me. So that's kind of how I got started with doing plastic surgery. But I've also been doing, what am I trying to say? Also been doing scar tissue release and scar tissue work, which kind of works hand in hand, because as you have an incision, it does disrupt the lymphatic system when you have an incision. So being able to do scar tissue release and lymphatic at the same time is definitely beneficial for post-surgery work.
Yes, and it's definitely been helpful for me. So I had lymphatic massages after my first surgery. They were a little bit different. She didn't do the scar work like you're doing on me. And she did like a red light something or other.
Okay.
And it helped. I think I don't really have anything to compare it to, but when I compare yours to hers, it seems like I have much more relief after I have massages from you. And especially my scar that they did a revision on that's in my chest area. It was painful, and it had like a lot of, I don't know, stiffness or whatever to it. And you just did one kind of, I don't know, rubbing or massage on it, and it's just gotten so much better. And so I think the combination has been really great for me, for sure.
Yeah, sometimes some people will do just lymphatic drainage. Really, it's really light work. There's a difference in treating just if you're coming in for detoxification, just doing really light lymphatic versus actually, I go by the feel of the tissue, because sometimes after tissue, some people have a lot more swelling or the depth of the skin is a little bit thicker or thinner. And then I feel like you have to address the scarring, because people scar and keloid underneath. And so as it starts to get thick, you don't get that flow. I could just do a light lymphatic and just keep doing that. But if I don't get that underneath, you're going to have issues like you were having already underneath, where you got that pain and stiffness, especially like near your sternum area. If you're having some down the center, you want that flow to go back and forth through any area really, but especially in the thoracic area where your organs are, you definitely need to not have any stagnation through there.
So let me ask a question. Scar tissue buildup, is that like blocks the drainage? Is that what's happening there? Like blocks the
Yeah.
circulation of it?
It can, because lymphatic drainage is superficial just underneath the skin. So when you have an incision, they're going to cut through the fascia, which after it begins to heal, the fascia gets a little bit more dense and a little bit thicker than it was before. If you've never had surgery, it's more fluidity. So you have more fluid movement. So it helps with the muscle movement. But once you've been cut, it becomes more like a little bit thicker and dense, the scar tissue underneath there. You're healing for sure, right? You know, people say, oh, you're healing, you're fine. It is fine, but if it starts developing underneath and it has a buckling, it can block blood flow as well as lymph flow.
Like I
Okay.
have in
Oh.
in my one knee, you had said that, and that was my knee that was like way more swollen than the other one. But now that you've been working on it, that swelling, that flow seems to be better, and the swelling has actually gone down quite a bit on my knee. So
Yeah, so when it comes to knee, because they have a thigh lift a lot, they go from the top to the center. So when you go down past like to the lower part of the knee, there's like what we call a watershed and release underneath the knee. So it doesn't have that ability to come around because you got that blockage and that incision through there. So if it stops just a little bit before the knee or middle, we can get it to actually flow that way. So for you, I actually had to reroute, like do a more pushing up so that we can get it, because your scar went all the way up into the inner thigh. So your thigh goes from the back of the thigh around. So when you have that blockage right there, it has nowhere to go from the top to the bottom. If it was a shorter scar, then it could have went around through there. So now we have to work from the knee and from the inguinal area up at the top, being able to get that fluid out of there.
yeah. So when you talk about the lymphatic system, I guess kind of, if you could just explain the benefits of, if you didn't have lipedema or you didn't have plastic surgery, just the benefits of the lymphatic massage in general.
Sure. Our lymphatic system encompasses our spleen and our tonsils and things like that. So it's our waste system. So basically the body is designed that anytime any fluid, extra protein and stuff is too much inside of flowing within your body system, and it goes right along with like the apparatus of our cardiac system. So, you know, our blood cells pick up waste, drop it off, provide oxygen to the tissue, and then it picks up waste, but then your lymphatic system picks it up from there, from the bloodstream, and be able to eliminate it. But what happens is the liver encompasses a lot with that too. You get a fatty liver, you have from junk and being tied up, then you kind of get that blockage too, where it can't receive waste and be able to do that. So the lymphatic system I always think about it like the trash system. Like we always get somebody to come by and pick up the trash they go through the neighborhood. So it's like your lymphatic system's coming by and picking up everything to get rid of it. But then it's like, hey, my truck broke down right here and I can't go any further. And now I got all this stuff just kind of sitting here. So it's more like a system that's flowing, just like if you have your cardiac system and you got, let's say you start having like lack of blood flow or blood clot or something like that in there, it's different, but it's more with lymph fluid that can't get routed to where it wants to be so that you can urinate that extra fluid out. So really when we urinate, we're urinating, waste that we've kind of gotten rid of. But sometimes people say, I hardly ever go to the bathroom. You might have a stagnated lymphatic system that's not getting rid of your waste like you should. So basically that's what it is. It's our system that runs along with the cardiac system that eliminates the waste.
Interesting.
That is really interesting. Yeah, I never it's just something that I don't think the world is educated enough on something like this. Like just I'm going to say the world, because like the fact that even and we talked briefly before we hopped on here that my doctor, and we can hop over to lipedema in a few minutes, but my doctor, when I mentioned to her, didn't even know what it was. And so I just don't think that there's enough information out there about any of that, because with or without lipedema, with or without having, Justy having her skin removal and scars, like there is a clear benefit to massages and drainage and all of that, and just getting rid of the toxins. Because when I was over 300 pounds, I did have fatty liver disease, and so that was an issue for me. And just hearing you talk about it, a lot of things make sense. And I did have swelling in areas at certain times. And I can remember certain instances of like tightnesses, like in my hand. Like now you can clearly see muscles
Your
knuckle
knuckles.
definition. Whereas before it was just like rounded, like I was always very swollen. You couldn't see
Mhm.
veins and things like that. And it's almost like if you just take care of your body, keep that truck running and it doesn't break down on the, on the highway, then you're good to go. Like if as long as I'm healthy, it's draining everything properly. So it's just I connected a lot of dots as you were talking, and that's just fascinating to me. And I really don't think enough people are educated on something like that.
I agree, which is why I started my Ways to Wellness business, because over the years that I've been doing massage, I get a lot of clients will say, I've heard about this or I heard about that, but why I don't understand, or I don't understand what's going on with it, or why I didn't know about this. And I'm not really sure where the disconnect is. I think that sometimes doctors are kind of overwhelmed a little bit. So I think massage therapy, we don't look at it as a complementary to your health. We look at it as relaxation, or which relaxation is still a complementary to your health because you kind of still need it to reset. But I think we view it as a luxury
A
versus
luxury.
it's still part of the body. We view it as, oh, it's something if I go do for my birthday, or if we're doing it with some friends, or if I need it because I'm hurting right now, versus if you kind of continue with the regimen and being able to have like a normal, I don't want to use the word protocol, but like a normal to your lifestyle, then you can see the difference. And I know it can be expensive for some people. So my rule of thumb is, if you can get something monthly, it will be great. But at the minimum, do something at least quarterly. You don't
Yeah,
want stuff
that
to
makes
back
total
up.
sense.
So yeah, and so our lymphatic system, I do hear some doctors say, well, you automatically, eliminate waste. It's just something that happens. Well, yeah, our blood flows on a regular basis too, but we still got cardiologists. We still,
Right.
if it just flowed without having any complications, we wouldn't have a cardiac department. So
Mm,
it's the same
right.
thing. It runs along with your hormones, with the endocrinology, the lymphatic system does, but I just don't think we look enough at our systems as much as we look at symptoms. We look at
Yes.
symptoms and we'll go and get medication for it to mask it, but we don't do anything about, taking care of it on a regular basis or being educated. So I decided to start doing a platform where I kind of talk to people more, especially in my expertise of massage therapy, but definitely want to bring on some different specialties that people can talk about other ways of wellness. So I want to get into other modalities, other things that people can just say, hey, I didn't know that I can go and get this done to kind of actually help out. And people, as much as massage therapists has been out there for pain, they still don't know that, hey, you got a shoulder injury, you can kind of go get some neuromuscular work done. So
I do have a shoulder injury.
Which is kind of something else I was gonna say is I have plantar fasciitis really bad, and she did this real deep, real deepness on my leg, but I also switched shoes. I've been wearing kind of a different shoe, but
yeah.
my plantar fasciitis is like a lot better. I've been doing stretches, but she got in there. Like she's not afraid to get in there. Let me tell you that.
Now
Um,
I need a trip to Charlotte.
oh my goodness. Well,
The
and it
trick,
was so
the trick to,
hard.
yeah, the trick to being deep is that what I've noticed from teaching, and I taught in a massage therapy school, is that people just like to strum it real hard. You go slow and you let the tissue work your way into the tissue. It will definitely feel deep and you can get in there. It's painful because it's already sore. So when we go in there and we actually get on some of those trigger points, then it's like, oh my God, like that's so tender, but nobody else has gotten down there. And typically when you have plantar fasciitis, your soleus muscle is right in the middle, but it's underneath that big fatty one where you see that calf definition. It's underneath there. So you got to be able to get to it through the middle or on the sides of it to get that soleus muscle to decrease in tension, where if you don't get there and don't get on the attachments, then you're definitely going to, and then on the heel, you're definitely going to still have issues with it, but stretching that out. But I'm sorry, but you got to get in there.
Well, and I had a hard time, not a hard time, but I Googled and I was like, oh, let me find a lymphatic massage person. I went to like the different, Massage Envy, they didn't have anybody, blah, blah, blah. And so I ended up getting your name from the lady who teaches me yoga. And she got it from a friend. But I was also surprised in a big city like Charlotte, how hard it was just to find somebody that even did it. Which I think kind of says something to kind of our lack of thinking it's important, but after experiencing it, I'll tell you, I will have my massage in the morning at 10 o'clock on Tuesdays, and I will pee all day.
Okay.
But I will be so much less swollen. I'll have so much less fluid by the end of the night, when typically in a day I gain fluid, right? So in the morning I weigh like 3 pounds less than I do at night. When the days I have my massage, it's actually opposite. So I thought that was interesting.
Yeah, your body's starting to get used to it and starting to respond to, oh, it's about that time where she's about to eliminate again. So one thing, that book, Body Keeps the Score. So your body does know, but over time, your body get conditioned to having these treatments and having that where it starts to probably eliminate a lot easier for you.
Nice. Yeah, it definitely is a difference. And even I'm getting them once a week, and I have since I was able to after my surgery, but definitely moving forward, I'm planning on trying to get them once a month, or,
Yeah.
Depending on life,
quarterly.
right? Yeah,
Yes.
yeah, for sure. So the next thing that we really wanted to talk about, and this is more Steph, so I'm sure she'll have more questions with this, is lipedema and kind of what it is, and then what are treatments that you would suggest to help out with lipedema?
And before we get into that, because as you were talking about the drainage and the massage and all of that, as a people love their massages, right? And I've liked them, but I always hurt from them.
Okay.
Because, and I think that, is there a difference between, this is one question I'm going to throw out there that you can answer as you're going through whatever is on your mind. Is there a difference in a regular massage, MV massage, right, versus something that you would need for lipedema? Because my legs are so tender that when they would do it, I'm like, God, this fucking hurts. Like, but it hurts, but it's good, but it hurts. And so it was like every time I would get a massage, I'm like, I want to like this, but man, I really don't like it. And that's probably because of the pain and tenderness that I have in my legs from lipedema, never
You shy
knowing
with
that,
them.
just
Yeah.
thinking that I'm a big baby and like, suck it up, you're getting a massage, like, shut up already. But that makes me think that there's got to be a difference in how you massage somebody who has lipedema that you're trying to do that lymphatic drain versus just a regular deep tissue massage, or what you would get at, like, I hate to keep throwing it out there, but like a Massage Envy or a more basic place like that. So that's kind of what's in my mind. So I'll let you go from there.
No, that's fine. And people throw out Massage Envy because that's something that's common that we see because it's a franchise.
Right.
So the difference is, first we'll start with the difference is education. The education of the therapist. And lymphatic work is a specialty. Just because you went and became a massage therapist doesn't mean that you're trained in lymphatic drainage. It is a specialty continuing education that you need to take. And then from there, you have to be knowledgeable of how to treat fluid. There's levels to it, and then being able to treat fat. So when we talk about lipedema, we're looking at an excessive fat. I got more into that after doing, especially with plastic surgery as well, but some people have the accumulation of fat. So that is the lipedema difference versus the lymphedema. The lipedema is more fat filled and lymphedema is more fluid. So, so there's the difference in that, where you get fluid and swelling, but the lymphatic deals with inflammation as well. So you got the accumulation of the inflammation and the swelling of the tissue, then you have the fat, or then you have the fluid. So when you're looking at lipedema, you're looking at a symmetric limb. So both of your legs will look like that, where lymphedema is typically one limb or the other. So you'll see that. So in lipedema, you can get it in the hips, in the thighs and legs. So like your lower legs can have it, your thighs can have it, or both hips can have it, and even the arms can have it. So it's an accumulation of that fat. Don't understand quite whether it's an autoimmune or where it kind of came from, but a lot of times people feel like, well, I'm getting fat or I'm just fat. I have had some clients that had plastic surgery from it. It can minimize it, not saying it's not going to ever go away, but having lymphatic drainage does help. I've done a couple sessions with something called liposage, which is manually. It is manually breaking that up and getting away. It does work well. It is very painful and tender. Fat itself is painful. Even if you've just got a little fat tissue and you're not even dealing with weight loss, I tend to find that when you're doing people with more fat tissue, are more sore from massage than if you're thinner and leaner. And you'll
Oh.
find more thinner and leaner people will say, oh, go deeper. And I'm like, how much more deeper? Just so like, but they want more of that, where people who have more weight are more tender because fat is tender. It's like that when you have plastic surgery. When you go get liposuction, it is painful.
Oh,
Suction is very painful, but the scarring or getting that tummy tuck is not as painful. It's just the incision. So fat itself is really painful because it's so closely related in the skin. And then you're looking at the blood vessels around it are very tender. So you get that bruising. So the bruising can come from the blood vessels that are surrounding there. And you got so much extra fat on there. It's a strain on the tissue and on the blood vessels where you can bruise easily. And then with the lipedema, some people have zero pain to severe pain. So if you have the lipedema, you can still have no pain, but still have the visual effects of it, that the legs or the limbs are very swollen and still have that excess fat. But it's not as painful. But they can sometimes have, I've had some people where there's no pain at all, but they get bruising. So
oh.
yeah, so that's where that come in from, is just that extra strain on the tissue and the blood vessels in the leg.
But what's we don't know what the cause of it is. Like, where does it come from? What causes it?
So I'm not really quite 100% sure, like I said, whether it's something that developed or autoimmune. I wouldn't think so, because I see it more in people either who have gained a lot of weight, or when they lose the weight, it gets stagnated in some areas. So once again, as the weight shifts when you're losing it, it becomes clogged up there. And then fat cells are living cells. So they might be multiplying, just kind of sitting in that area. So I've seen a lot of it where people will lose weight and the top of them will just go down, and then their legs are just heavy. And
That's me.
it's settling in the legs. So even though you're losing weight, there's some stagnation going on somewhere in your leg area that's causing you to have that buildup. And that's why they say, okay, if we just go lipo that out. But I would suggest that maybe doing some lymphatic drainage massages. And actually, I know it's kind of could be tender, but you just start slow. They should start just slow with you. The other treatments that I do is something called an endosphere. It's a roller system that actually, it's like a device like this, and it has like 55 spheres and rollers. So it breaks up the fascia, because fat likes to sit inside the fascia. So even when you see cellulite, people are like, I just want that out. It's this, the fascia has gotten really tight, where those fat cells are kind of like peeking through. They're kind of just popping through there a little bit. And so now you've got this accumulation of fat. So breaking that up and getting that fluid that's filled to kind of break down and release some of that. That's one way. Another way that I also do is what we call an ice treatment. So it's sculpt ice. So it's a block of ice, and it's an all natural product that helps break down fat. So the main goal is you want to help break down fat cells and get the fluid out of the fat cells, so you can kind of decrease the fat cell, even though you're freezing it can sometimes freeze it till it bursts, or you're going to get it suctioned out. And there's some devices sometimes that use heat. You're either going to destroy the fat cells so you can get rid of it. But when you lose weight, a lot of times the fat cells just decrease, which is why it's easier to gain weight afterwards. So you really want that fat cell to be destroyed, not necessarily deflated.
Okay.
That's
That's
interesting.
interesting.
Yeah.
Yeah. So when for me, I've always been, when I was over 300 pounds, I was very curvy, very all the shape, butt, hips, thighs, but also, well, I have a hoodie on, you can't really tell, but my arms also, and this is all, I can tell here
I
is
can
the
see
end
it.
of my like muscle. And then this is all just the skin that was left. So I've always had really big arms, very big hips, butt, thighs. And then when I lost the weight, I am like, if I stand in the mirror, I'm like, I 1000% have abs under here, and that's insane. But my legs are still like tree trunks. So it's like, it's crazy to me. My stomach, I always said, like, I would like to have the stomach apron taken off, but that's not even my biggest issue, because I tuck that into some high-waisted leggings, right? So nobody ever notices it. But you can only tuck so much of this. And I
Yeah.
can't even, like, I could wear a size medium if it wasn't for my arms in a shirt. Like, I can't wear a size medium short sleeve because it turns into a tank top. It just sucks right back into my armpit so I have that very big, like, arm. And then my legs, same thing, with both my calf and especially my thigh. So I kept a lot of fat in those areas. And it's almost like even when I was running, it didn't matter what I was doing as far as exercise goes. It's just that's where it stays on my body. And then I've heard that liposuction is one of the only really ways to treat lipedema. But the friend of mine who had liposuction, I guess it's a different wand. I don't know what the right term is that they use for lipedema versus regular liposuction. And she said she was in extreme pain because you need a bigger suction thing for
A
lipedema because
cannula.
yeah, exactly. Yeah. Because the fat cells are bigger. And I guess they didn't know that when they did it. And she said it was the most pain she's ever had. And she was like, I'll never do it again. I don't even care. I'm going to keep these chunky legs, because she was just like, I would never, ever do that again, because they just wasn't enough education, I guess, to know that it's a different type of liposuction even. So the whole
Yeah,
thing's kind of scary when you think about it.
there are some plastic surgeons that are specializing in the lipedema right now. Sometimes I had a client where the lipedema was um really heavy in the legs, and when she went, she was only able to get the front of the legs done and not the back of the legs. So she had to do the front of the legs, wait and heal, and then go back to surgery to do the back of her legs. Um, but yeah, it's different because it's thicker. And so sometimes when you're doing liposuction, people are like, well, I got this little area they didn't, but if it's hard and it's chunked up, they got a certain limit of time while you're under to get it done. And then you have a certain amount, there's restrictions on how much you can take out. So to get you that look that they want to do, they're going to go around. They're going to try to chunk it as much as they can. They're just going to come around. Let's get the maximum fat and let's get the area that we need to get and try to still give you that look that you're looking for. But like I said, I've done quite a bit. Even in my book, I have a picture of a young lady that I did the ice with, and it's like half of her leg after doing that. Yeah, and she's kept
Wow.
it down really well. So, and I know some people will say, well, you could just exercise and do that and your lymphatic system will just go down. It doesn't just go down. And some people need a little bit of extra, you can dry brush. To me, the dry brushing and exfoliating stuff and then being able to do your own treatment, that's just like a maintenance thing that you can do at home. And it's not for, I mean, you're not going to just dry brush your lipedema away. That's not going to happen.
Right.
So you definitely will need something to kind of break that up, and then being able something that actually breaks down fat cells. So like I said, I do the ice here because I'm not a plastic surgeon, but it does work well. If plastic surgery is not your financial thing that you can do, maybe kind of look into having some kind of fat breakdown treatments. A lot of machines are out there only do like section at a time, where you're like in that one section forever and you're like, hey, I got a whole leg, which is why I started doing the sculpt ice, because I can actually do 360 circumference of the whole leg in both legs versus just having a machine just either sucking or vibrating one area of the leg.
And for something like that, like how many treatments would somebody need to have in order to see a difference? And then is it like a permanent thing, or you have to keep doing it type of thing?
So are you asking for a device, or which one are you talking
The
about?
one that you do, the ice
So the
sculpting.
ice that I do, basically, like when it comes to doing the ice, it's a preference, right? I always just do a package of 3. That's the minimum, where you can at least see some definition and some change. Depending on how wide it is, you can go down 1 or 2 inches, but if you got a really big leg, then people are like, I don't really see it, but you have to hang in with there, because over time, I've seen people like 2 weeks later be like, oh my God, I'm really starting to see it. The people that I've worked on with it, I have not seen a huge, comeback. That based on diet. It's based on diet and exercise. So it's no different than going to get plastic surgery or losing the weight. And then you say, okay, I'm skinny. I'm not going to do nothing. I can eat what I want to eat. Next thing you know, you're gaining weight. Nothing that you do is going to stay when it comes to fat without keeping it up. So
Right.
how many sessions you have can totally be up to you. Like, until you get to where you want to be.
And how much time in between sessions?
So according to the company that I use, Sculpt Ice, you can have as many as 3 in a week, Or I don't do 3 in a week unless like I've had people come in from out of town and I've done them there because they're here just for a week to kind of get what they want to get. But if you're like local and this is some place that you're going to, I would say either once a week or every other week, because it continues to work for like 3 to 5 days. So why waste your package on doing 3 times a week when you can just do weekly and spread it out because it's going to continue to work.
Gotcha.
Right.
Gotcha. Interesting.
And so if you were like, for me, I don't live in Charlotte. If I was to
Mhm.
look for something like that, how would I even go about looking for that?
So the company is called Sculpt Ice. I know that there's another company out there called Pure Sculpt. I don't know their product and I haven't worked with it, but it's the similar, like their, I guess would say competitor is similar to that, where it's a block of frozen ice. So this is all natural ingredients. So it helps with the smoothing of the skin, to break down the fat. And so I really love it. It smells really amazing. But clients really like, it's cold. I'm not going to lie, it's cold. I think cryotherapy is like one of the best, which I'm actually getting ready to get another cryo machine that helps break down fat as well. So this is cryo through CO2. So it's actually going to be a spray one that you do, where the Sculpt Ice is more like if you're getting it's almost like if you're getting a spa clay treatment, because it's really messy, but you kind of lay there in your disposable underwear and then you get to the ice on you, and then I'm literally sculpting you and doing lymphatic drainage at the same time. So the good thing is that you're working, but as we're breaking down the fluid and the fat cells, we're actually draining you at the same time. So you're getting that fluid movement. So you can see the results a lot differently when you're doing that because it's happening at the same time. So it's not like something where that was one of the things that cool sculpting, when people first started doing that, they're like, oh, it's taken up, you know, or they were having all these issues because there was no lymphatic drainage massage. You can't decrease fat cells and not really have nothing for it to go, which might be, while I'm thinking about this, something that lipedema is starting to do, is because people are losing weight and doing stuff, but they're not doing lymphatic. So it's accumulating because you got to be able, it's too much for the system.
It's a lot of waste.
Our
Yeah.
system
And
is
where's it
slow
going?
and we're used to doing this. And now we're doing over an extended type of things where now that you're getting a backup because it's too much for it to handle.
And isn't there also a laser water treatment type of thing that can be done too? Like a
I haven't
laser
heard of the
water?
laser water, but I'm sure that, you know, they got so much stuff out here.
Feel
But
like
that
it
would be
might be
something.
the office here, the lipedema specialist here. Maybe I
Okay.
saw that on theirs because I'll tell you, I got interested in it after hearing some more about it at the retreat that we went to, and I started doing my research. And luckily, because there's not a lot of lipedema specialists out there, I do have one right here. I live in Delaware, and there's one right in Wilmington,
Okay.
Delaware. They don't take any health insurance though, but they
Mhm.
do take the like
HSA.
your yeah, exactly. And so I upped mine this year because we're getting ready to start a new year. So I bumped it up because I'm like, what's the difference? It's, you know, when you put that money in, it comes tax free out of your pay. And if I'm going to pay out of pocket, sometimes if you're paying out of, you know, you're paying out of pocket, you can work out a deal anyhow. And then if I pay with that, I'm like, okay, that's better because otherwise, you know, I'd still have to pay with insurance or meet my deductible and all of that. So I'm like, okay, I'm gonna just bump that up a whole bunch and hope for the best that I can get some kind of, I'm just excited that there's treatment out there for this. And it's just something I never A knew that I had, or B knew that there's treatment, because like I said, my doctor didn't even know what it was, because she was like, I thought you were saying lymphedema, and I'm like, no, definitely not lymphedema. She's like, yeah, I didn't think that. So she was confused too, and I'm like, oh boy, this is going to be a one heck of a battle when you're talking to people that are professional, you know, medical professionals, and they don't even know. But like you said, it can be, you can't expect somebody to know everything, so it's good, just one
Sure.
of those things that slips through the cracks because it's not talked about enough.
It's not. I just did an interview on my podcast, Ways to Wellness. I just released a young lady who has lymphedema, and she got it after having a tattoo. But so she was talking about her journey on how the doctor diagnosed her with lymphedema and was like, okay, this is what you got to do. You just got to start wrapping it. This is what it is. And never told her about lymphatic massages, never. But I think there's a disconnect, which is something that I would like to bridge the gap between um, the healthcare physicians and community and massage therapists. I think because we're so looked at underneath that, oh, that's just a spa treatment or that's just this, that it's not like, oh, they want to somewhere they want to send you. First of all, they don't really know that therapist. So one of the things I would think as lymphatic drainage specialists, we need to be more in the community of partnering with physicians and being able to give them information, because they don't know what it is that you learn and what you do. So they don't know how to send you. So that's another issue. I think that there's a disconnect between us and them. I literally have friends who are physicians. It was like, oh my God, I never even thought about that, you know? So there's something that's like beyond their mind. They're like, okay, what can we give her to help her out with this? Versus like, hey, let me think about, and there's physical therapists who actually do lymphatic drainage as well, but you don't really hear that in the physical therapy world as well, unless they're specializing in it. So, there's definitely a disconnect with us, being able to kind of get more in the community. Once again, this is kind of my mission right now, as I can get more and more of the community. And I remember when I worked in the hospital and I worked on the heart lung transplant team. And so the one young lady had just got a pair of new lungs. And she had so much swelling in her arm and hand. And so I had got a consult to go see her. And so her transplant doctor was like, oh, it's time for her spa treatment. And I'm like, it's not a spa treatment. So she kept telling him, like, this is working. My arm is getting better. And he was like, yeah. And she said it again. So one day I was coming out of her room and he was at the nurse's station and he asked, can I talk to you for a minute? And so I was like, yeah, he was like, what is it that you're doing with her? And I could have said, I'm doing lymphatic drainage. But when he asked me, I knew in my heart that he wanted to know, what is it that you're doing? And so I explained to him, like, hey, this is what. And so from there, he was like, I had a knowledge of what I was doing and be able to understand it and articulate that with him, that he was like, all right, well, good work. Keep up with that. He's like, she's really, raving about the work that you're doing and her being able to get a lot of relief. So sometimes, like, you can't just be generic with them either. Like, just say, hey, I'm just doing lymphatic drainage massage. And he's like, okay, I don't really know what that is myself, because he hasn't went to school to learn lymphatic drainage massage. He went to learn how to remove lungs and give you some new ones.
Right.
So, that's his specialty. So, but the after effect, he didn't realize, like, hey, there might be something that can minimize, other than taking Lasix and give her something to get the fluid off. Like, here's a modality. And then he started, hey, referring his clients to me. So it's just the education part, I think, that's really missing in the piece, that physicians know, first of all, how to treat it, what you're talking about, and being able to articulate that with them so that they can trust you. To patient, they've just given a surgery and they're not going to let you be like, just go manipulating if you don't really know what you're doing. So that's a huge thing between the therapeutic community as well as the physician community.
It's also a really big thing, which Steph and I that's our mission too, is the same thing with like the medical field and obesity, right? So for years it was just eat less and exercise more, and we'll put you on a 1,200 calorie diet, and why are you, you're fat because you don't do enough exercise or whatever. But now we're starting to realize it is a disease. It's a metabolic makeup. There's a lot of elements. There's a lot of different treatments. There's a lot of different things that people respond to and don't respond to. And I'm sure it's the same with the lymphatic system. It's one of those things that was kind of like pushed aside, but they really do go hand in hand when you think about it.
And I always say that this is alternative ways to your wellness. So we're not taking away from the community. There's nothing I can do. Even though you can do a lot of different massages for pulmonary issues, there was nothing I can do to keep her from not having lungs. You're still going to make money. You're still going to do that therapy, not even just making money, but they're still going to come to you as a physician. But we want to be complementary to her healthcare, or his or her healthcare, and to the community for their aftercare. Why not help someone to help the recovery? So even after having surgeries, when you have lymphatic drainage, this is just going to help, because when you do lymphatic drainage, it is a part of your immunity. And so we say that is, as we're manipulating, we ignite this white blood cells to like wake up and start coming to those areas. So now you're increasing your white blood cells so that it can actually go and help with the healing in the tissue. So that's why you get decreased inflammation, inflammatory responses, and decreased swelling. Then the white blood cells have their way of going in and doing things too, not just saying, hey, you know, kind of we're sitting here a little bit, but you're just kind of waking up that system, just like when you're doing massage. You know, some people don't believe that we can increase and get a flush and flow of red blood cells. But of course you can. So actually you're moving it along, you're actually hydrating to the tissue. You can physically and vividly see that change in the skin, even when you're doing massage. You know, skin looks brighter, things like that happen. The other thing is that I remember doing lymphatic drainage on some neural patients. When I worked in the hospital, they had an external shunt, and you have the device sitting out there, and you can see the fluid building up in it. And I think they were kind of like, wow, like, man, this is actually really helping. And so we got to see that fluid coming off the brain, coming off the head. So that extra pressure, which is going to be my next book, I'm doing the head, face, and neck. But you know, we got a whole body that's dealing with fluid. We're full of fluid. You know, our body is mostly water. So when things are not going well and we're not hydrated enough and just getting stagnated. But like I said, you know, with the lymphedema, you got the fluid buildup, and with the lipedema, you got the fat. So I definitely feel like we all should be doing it on a regular basis. I think that we'll see a whole turnaround when people start doing more lymphatic drainage work.
Well, and I think that's a lot of people, and I know I was a victim of this for many years. I just couldn't afford it. I was a single mom, and I didn't put myself as a priority. I do now, but it's one of those things that of the list of stuff that we have to do in life, right? It's kind of something that's put aside. And it's funny because when I was doing my massages with Summer, I was like, she has a package for like 3. And I'm like, do you have a bigger package? Because I know if I buy it, I'm going to do it. And so she put on a bigger package so I could just buy 5 of them. And then it's like, okay, I know I'm going to do it once I spent the money. But if we had a heart problem, or if we had any other problem, we wouldn't think about spending the money on ourselves. And we do that with massage, with our lymphatic system. And we do that with weight loss, not wanting to spend money on a nutritionist, not wanting to spend money on a dietitian, or even to have the bariatric surgery like Steph had. But it's kind of like that will solve so many problems in your
Yes,
future. You know what I mean?
it definitely can. I've been seeing an influx too of people with a lot of stomach bloating. And I think it might be foods that we're eating and stuff like that. But I've had quite a few people where their doctor is saying, hey, you know, you're getting, even though they're smaller, they're dealing with a lot of bloating in the stomach. It's like, you know what, I think you should get a lymphatic drainage massage. And I'm like, oh, okay. We're starting to see that they're, you know, kind of coming into the gut issues. You're starting to see gut doctors starting to say, hey, look, let's get you in, having lymphatic drainage massage, and see if we can kind of get this swelling at bay. But yeah, so that's something else it's very small. It's starting to pick up though in some of the gut community. Functional medicine doctors are starting to look into more, hey, let's look into that. But I want to circle back to Steph when she was talking about, you know, the insurance too. That other piece of that is that if your doctor's office kind of know how to, or your insurance company have someone who knows how to code it, because lymphatic drainage has a special CPT code. It's a modality in itself that actually has a code. And so if you go someplace and you put in, I want to do massage, that's a different thing than saying I need lymphatic drainage. So then there's that other piece to that of being able to say, hey, I need lymphatic drainage. They know how to put it in from the doctor's office and know how to use those codes and being able to get it approved versus just saying, hey, I need massage therapy. That's the difference. When you're looking at insurance, you got to know how to code. You got to have a good coder in the doctor's office, and they need to know what the doctor is looking to have done. So there's verbiage there that has to be done. So even I accept the FSA, HSA, I don't accept insurance, but when I write it up for a client so they can get reimbursed, then I write up the language that's needed for what we're doing with you, and then write in the CPT codes on there.
So you're saying that although you don't take insurance, it should be something that you can get reimbursed for if it's coded correctly.
if your insurance company is saying, hey, okay, like I'm looking at this, they still don't look at the plastic surgery world, but right, you had bariatric surgery, which can be paid for, but be like, hey, I had this bariatric surgery, but all my fat kind of accumulated here. Is there a condition that we can go with that? And then from that condition, let's break it down into the lymphatic, which has CPT codes. If they knew what they were looking for, listening to, it could have been a different outcome possibly for them to approve it.
Interesting. Yeah. And I'll tell you, while we were talking too, I real quick, because I'm like, I know I saw this water laser something somewhere. So I real
Okay.
quick went to the website of the local lipedema specialist here, and it does say they use water jet assisted liposuction. During the process, the surgeon will use a physiological water like a normal saline as a pulsating jet that releases the adipose tissue for liposuction. The excess fat is simultaneously sucked away from your affected limbs. And it says the treatment is very effective in treatment of lipedema symptoms, primarily skin pain and tenderness, reducing the weight of the legs and improving mobility. And I'm like, that all sounds like a dream come true.
Yeah,
That
and
would
it's a
be great.
we just got done talking about play on words. That's definitely a play on words. So there are places that do now awake lipo. Anytime you're doing lipo, you can't just go in and just start sucking out blood cells. I mean, fat cells, adipose tissue. Even plastic surgeries, they use some kind of fluid which is why you get that excess fluid where after plastic surgery, we're going to go in and get it off. So when she's saying we're doing water jet, and she's not saying we're doing liposuction. We're doing a different form. It's still water-based, which is what you do when you're doing liposuction. You've got to have some kind of fluid going in. So it's a nice treatment to say, hey, we're doing water jet, because that she's probably not, there's something in that procedure that's not part of the liposuction, but it's similar because she's
Right.
doing suction and she's influxing with water, and with a cannula with suction, which is liposuction.
Mm-hmm.
They're
That's all
fancying it up.
fascinating. Yeah. Listen, whatever they got to do to get my insurance to help me pay for it, because I'm like, it's overwhelming when you think about it. But at the same time, we'll think about things like running. And I would say to my husband things like, I feel like as I lose weight or if I have my skin removed, I would be able to run faster, because I literally feel like sometimes my legs are fighting each other when I'm trying to run. Like I can do it, I got the movement, but my thighs are like fighting around each other because it's the biggest
Yeah.
part of my body. And so I think I might actually like it more if I wasn't in a constant battle one leg at a time. So I'm like, all of that makes so much more sense now that it just stays there and builds up there. And I feel like I have two like tree trunks that I'm trying to move with. And it's like, I feel weighted
Yeah.
down a lot. Yeah.
And that's another thing is that fat weighs and then skin weighs, so you got the weight of the skin and so we don't even think of skin as being an organ. You hear that, be like, oh yeah, the skin is one of your large organs, but we don't treat it like it's an organ. So it's literally an organ. So when it's been stretched out and it's overdone, and then we have this excess weight and it's heavy. It's really heavy when you're trying to maneuver it. And then when your body is smaller and you've decreased it, now you're carrying around the weight. It's almost like carrying a sack around because you have this excess weight and skin that's kind of weighing you down, but now the fluid from it is gone. The fat cells are either removed or destroyed, like we said, or the fluid that's in it is now gone. So now you have this skin, which is a little bit heavier in density. Even if when you were heavy, I'm sure it was harder. You weren't running fast at 300 pounds either. You know what I mean?
Right.
So it's the
Right.
same thing. You've just deflated, but now you're still carrying that extra in the organ.
And
Yeah.
for me, it was interesting getting rid of the extra skin, how much, especially in my legs. So they only removed 3 pounds in my legs. So about a pound, a little over a pound and a half in each leg. But it's just made such a difference in
Yes.
the way I walk, the way my legs don't my feet are have come together when I walk because they're not being separated by all that fat. And I just don't feel like every time I step, I get this surge of jiggle or I can't even movement that kind of weighs me down, if that makes sense. It's
Yeah.
really interesting how it's just been so life-changing on my arms, on my abdomen, on my legs, on everything. But yeah, so having, if I don't have lipedema, but if I did, I can imagine that weight of that
Yeah.
fat, that extra fat for sure.
So now you're also even describing better blood flow.
Yeah.
So you don't have all that tissue and all that fat your blood has to kind of filter through to nourish all of that extra tissue, nourish all that extra skin. So now your blood, when you're working out and you're running, your blood's like, hey, we got pathways. We can go flying through here and come up and down, come back and forth. It has room to hydrate you and to sufficiently give you the nutrient that you need, because now you've gotten rid of the other stuff that was actually blocking that flow, where you get a slower flow, which is where you'll see people, with diabetes and other things like that, that's disrupting that blood flow. When you got diabetes, you got extra, it's almost like syrup. You're having this extra glucose in your system that's causing the blood to be thicker, to move a little slower, not as well as it was if it was hydrated with all that extra sugar. I think about when you have some water and you pour the sugar in there, right? The water is still the same water, but now it's thick. So that's kind of the same thing when you're clogging stuff up and your blood system doesn't get a chance to flow as well. Then of course, then the waste system is waiting, and it's like, oh man, you're gonna give me all of this? Like, okay, now I gotta truck this stuff around. It's like having a heavy system trying to get rid of all this stuff and this waste. It's the same thing. So now you're experiencing like, hey, this feels good. I'm sure if you really would have paid attention, you would have also saw that your skin is better.
Yeah. I
Yeah.
mean, I do have people tell me all the time, like, oh, wow, you have really beautiful skin.
Yeah.
And nobody told me that before, but it was because it was hangy. I didn't let people see it. But it was interesting how you said that people are coming to you that have digestive issues. Something that I noticed, and I noticed that the last time I had lymphatic drainage as well, because I had all those incisions on my abdomen, right?
Mhm.
And so every time I get a lymphatic massage, my stomach starts gurgling, like growling.
Yeah.
And I'm like, oh, is that making my stomach work, or what is going on here? But every single time my stomach starts growling. When I get normal massages, like from Massage Envy, I don't have that happen. But when I get the lymphatic massages, my stomach starts growling.
Yeah, because once again, it's part of helping with immunity in the gut and helping with gut hydration and nutrition. So we're working on the gut. Your intestines get some freedom of movement, as well as you get those are still tissue. We don't think of all of these things in our body being tissue. If we're hydrating tissue, we're hydrating tissue, whether it's smooth tissue, rough tissue, cardiac tissue, striated muscle tissue. It still all needs to be hydrated. So that helps with bowel production. So part of the liver helps with bowel production. So when your liver is functioning better and producing better bowel, then your small intestines can receive it. Your large intestines, you can kind of poo it out. So you're getting that whole consistent thing. And people really we do not talk about the liver being as healthy as it should be when it comes to that. So, having that fatty liver is everything. I've even noticed one time I just started doing a liver detox, and like immediately I lost like 12 pounds in a week just doing a liver detox. So it's like the liver's like, thank you, I need some help here.
Right. And I'll tell you,
Right.
interesting about that too is when I found out I had fatty liver disease when I was having gallbladder issues, and they just said it so like, oh,
Casual.
and yeah, it shows that you have fatty liver disease, and nobody ever told me what about it. And me being over 300 pounds, I'm like, well, we're just not going to talk about it. We don't talk about it. It's not real, right? But nobody ever was like, when they did I don't remember how they saw it. I am totally medically untrained to speak about anything, but I don't know if it was an MRI, if it was a ultrasound. It might have been an ultrasound. I don't remember what they did. This was years ago, but when they were like, yeah, we found that you have fatty liver disease, and they just kind of breezed right past it. And I was like, okay. And then I did my own Google research. I'm like, that doesn't sound good. We're going to pretend we never heard that. That's logic. That's how fat people logic works, in my opinion. For me, I just was like, if we don't talk about it, it's not real. So that was my thinking, but nobody, yeah, there was no, yes, you have it, not like here's what you should do about it. It's, better diet and exercise, and it can reverse itself. And that's it, the end. No talk about liver health after that. And I
Yeah,
think
I
that
mean,
was really
it's the
interesting.
same thing, I think, with anything, right? Even something simple that everybody do know about, like diabetes. Um, it's just medication, or you can say, even when I went to my doctor, she said, "Oh, you're kind of close on the borderline, but you can control it with food." And I was
Mhm.
like, "Okay, well, let's." She was like, "I can give you something, or we can control it." And I'm like, "Well, why would I take something if you're saying I can control it with food? What do I need to do?"
Mhm.
But once again, I went to a functional medicine doctor who talked about that because I was going to another doctor. They just put you on these weight loss clinic. But my A1C, and the other thing that happened is that, having a balance of, it was a weight loss doctor who actually found out that I had sleep apnea. My A1C was going up. And I was like, man, I eat pretty healthy. Like, I don't know what's going on. And he was like, your throat is so swollen. But what I think happened was after me having COVID really bad,
Mhm.
my throat from coughing had got so narrow that it was blocking my airway. So the doctor was like, "Yeah, like you barely can breathe out of here. I don't know how you're breathing." And I was just like, "Well, I don't know what happened." And it reminded me that when I had COVID really bad, that I could not hardly breathe, and I was coughing so bad that I had got swollen. So I got on the CPAP machine, and it was like night and day.
Wow.
So yeah, so those are
Yeah.
other things that we don't think about, that lymphatic drainage even can help with people with COPD and breathing and smoking and the pulmonary issues. There's a lot in the community far as that we can do better with far as massage therapy being educated on. And I think that that's just something that just needs to happen. And people might be like, "Oh yeah, I don't want to get a massage for that." I'm talking about maintenance. I'm talking about helping movement. So even when I'm doing lymphatic drainage, it's so slow, but if you find an area that can open up, it makes a huge difference for the rest of the body. You can actually increase your flow, by 10 times by just doing a lymphatic drainage massage for sure.
Mhm.
Mhm. I'll tell you, funny you said that about sleep apnea. My sister, her dentist, the dental assistant is the one who figured out that they think that she had sleep apnea because she had braces at a younger age. They removed
Mhm.
teeth. Her
Yeah.
mouth got smaller and she's tongue tied. And they think
Wow.
that that is causing sleep apnea, which caused her to end up in in the hospital. She was in the hospital for a few days with what was they were thinking was a cardiac issue because she was having pain, sharp
Mhm.
pain in through her arm and chest, and they decided she should just go. Well, when she went, they didn't know what was wrong with her. Fast
Okay.
forward a couple weeks after that, she had a dentist appointment. The dentist is the one who was like, I see you're on this, or the assistant said, I see you're on this medication for heart. Did you have a heart issue? And she told them what happened. She's like, here's what I think the problem is. And come to find
Mhm.
out, yeah, smaller mouth, um, tongue tied. And so at night, they're like, she's like, do you stop breathing at night? And my sister's like, I mean, I don't know, but she doesn't wake up well rested. She has trouble sleeping, put
Yeah.
all of that together. And it's the darn dentist that told her. She spent several days in the hospital and they were like, here's a bunch of medicine for you to take. We
I
don't know what's
know.
wrong. So they pumped
Yeah.
her up with this cardiac medicine, same treatment that they would do for somebody that came in with a heart attack. But they were like, here's cholesterol medication, take baby aspirin, take all this. And she was really upset because she doesn't take medication. She's been on a wellness journey for a while and tried to get off of everything. And then they give her 4 different medications to take. She's all upset, but they don't know what's wrong. I'm like, does she have high cholesterol? He's like, I don't think so. I didn't see that in the paperwork. I'm like, what's happening here? The doctors are just like, medicine, medicine. 2 weeks
Yeah.
later, she goes to the dentist and they're like, you have sleep apnea, likely because of these things. And
Yeah.
I'm like, so yeah, it's just like the medical world is interesting and it's not always, some of it is just, it's not as clear cut as what people seem to think. And she's
Mhm.
been fighting with her weight her whole life too. And it's just like, well, if you would diet and exercise, you wouldn't have hurt your knee. And well, how do you think I hurt my knee? Exercise.
Yeah.
Like,
Yeah.
man, yeah. It's all
It,
full
Yeah, that's
circle though.
it is full circle because anytime you get, like I said, lack of blood flow, a sprain or injury to it, even after orthopedics, I tell anybody if you have any kind of surgery, any kind of scar, you need to
Mhm.
get lymphatic drainage. And so,
Mhm.
like going back to what Justy was saying that, if I couldn't afford it, I get that, but like even I talk about it in my book, just giving you a protocol, anything that you can kind of help yourself do a little bit
Mhm.
also can be beneficial, even if you just kind of doing some stroking up the legs and arms to get some kind of flow. Um,
Mhm.
it's helpful. You might not be as educated or as skilled as a therapist, but you can still at least get some flow and some movement and attract some blood flow to that area so that you can move stagnation.
And there are
Lovely.
some, I Googled or YouTube, there are some videos that teach you how to do like self lymphatic massages.
Mhm.
So at the bare minimum, if you at least just do that while you're in the shower, or, you know,
Yeah.
when you're putting your lotion on your body every day, or, you know,
Yeah, just doing the
whatever.
inguinal
Mhm.
areas, the tapping, and then
Yep.
doing movement. Those
Mhm.
things, because the lymph nodes which is what happened in breast health a lot of times too. Our axillary nodes get kind of blocked up. And not going into that book, on my Balanced Boobs book, the lymphatic system and the boobs are huge. We wear breast bras all day. They're encompassed in, they're tied down. They don't get that free flowing through there. And so your lymphatic system, especially wire bras and everything else, you're cutting off the flow. And so once again, if we're not even taught even just regular breast surgery, you know, they say, oh, do your breast exam. I can probably think of how many women literally do breast exams on a regular basis. And so I was having, because I'm specialized in breast health and I do lymphatic breast health as well, people, you know, clients will come in and say, oh, my breast is dense, but I don't know what that means. Doctor said, oh, it's fine, it's just dense. And I'm like, well, if you take a dense breast and you do a lymphatic drainage, you'll feel how much it'll soften up. It's amazing how you'll see the tissue will soften up. I literally had a young lady who actually told me that her breast milk ducts were backed up since her daughter was 5. And I'm like, what about a lactation specialist? You know, they didn't send you nowhere. And she was like, no. So she just walked around. And so she was very hard underneath the armpit. And it literally, she's like, oh my God, they're just going down after one session. But it's huge to be able, you'll see the difference. And it's hard because people, when they do massage, a lot of people, they were like, oh, I want deep, you know, they just want to like, I want to feel and be moved around, but you can still feel better. Just like Jesse said, over time, like, I'm starting to notice my body, but it's not something that you're gonna be like, oh, are you doing anything? Because it's super light. But over time, you'll start to see like, man, I'm starting to feel better. I'm starting to see the results. I'm starting to feel, you know, a difference in there. My incisions are better. You know, I don't feel pulling, you know, all of that thing, you know, all of it helps. All of it helps with you over time being able to see that. And I think scar tissue is really good. I remember a young man who had surgery, ACL surgery and stuff at the knee, and he had PT for a while, and he was like, well, they just told me to start walking, it'll get better. And so I was like, well, you got a lot of fluid still on the knee. So we did lymphatic drainage, and he said, man, I haven't been able to straighten out my knee for a while. So, you know, it's little things like that. It's not like we're trying to take on your money. If you come for a little bit and you start to get that result and better and it's softened up, then, you know, that's fine if that's what you want to do, but just not leave people like that. And over time, it becomes an issue later on, 5-10 years down the road, when it could have been addressed with something as simple as just, you know, getting it free.
Right.
So
And that's why
for
the education is so important. And the fact that like you have to be an advocate for yourself, because if you're not, if you just take that as an answer. So I recently hurt my shoulder slipping on ice. And I was telling Justin, she's like, oh my God, had a similar injury. And she ended up having like torn rotator cuff and all this stuff. She's like, so get a second opinion, like stay on top of it. And I'm like, oh shit. Like here I'm thinking like, yeah, I'm in pain right now. But they told me like they literally were like, yeah, nothing we can do. Here's this muscle relaxer. Best of luck. If it's still bothering you in a couple weeks, go see your primary, which you can't get an appointment for anyway. So I don't know why they tell you that. So I'm just like, oh, okay. So I just went and I gave them my money and got shuffled out and told me best of luck. And then Jesse's like, no, she's like, get a second opinion, keep like stay on top of it.
Yeah,
I'm like,
and
okay.
if nothing's torn, if you had an MRI and nothing's torn, you definitely can find someone who does neuromuscular therapy, because our bodies shift, right? So if I was to fall today, my hips might shift. You can get up and be like, oh, okay, I'm fine, I'm not hurting. Then later on, you're like, dang, why is my lower back hurting? And it could be maybe like a year later, but your body shifted, which is where chiropractors come in. But later on, you're shifting, and I don't feel like you should get adjusted without getting your soft tissue done. That's just my opinion. Because when people fall or they're injured, your soft tissue starts to tighten up after you're left a certain way. It's our body's mechanism of always wanting to stay in balance. And even though you're out of balance, the body's saying, hey, I got space here, or this is crooked, I want to go in and I'm gonna tighten up here because I got space in here. So that's kind of how, massage and neuromuscular work, that's what we do. We want to bring it back into balance because it's been out of balance. So, we're not taught that. Just get up, shake it off. Okay, you're okay. But then later on, you'll see issues where like, dang, why is my back hurting? Or people don't even realize if you lay flat and got to cross your legs, there's an issue in your lower back. When you're standing and you got one hip, one foot in front of the other, it's because your hips are off. So, all of those things were just like, oh, it's okay. I don't need to go adjust that. But the reason why you stand like that is because your spine needs to stay in alignment and adjust. So your hips will adjust to kind of keep you upright. So all of those things are adjustments that have to take place. It's never just a one thing. We live in this world, we're doing stuff, we fall, we get up, and that's why we exist.
Yeah, so I really think that this was super, super informative. I know I learned a lot, and I actually have been talking to you for weeks now. So so I guess what I would like to do, when I'm done, I'd like you to plug whatever you want to plug and tell them about your book and your podcast and that sort of thing. And we'll add it on to our Instagram posts and stuff. But so if you are a person without plastic surgery or lipedema, then you're suggesting at least quarterly, but hopefully monthly lymphatic massages.
Correct.
And then if you're someone who's had plastic surgery, as soon as you're able to start getting that, and I will attest to that, get that going, doing it kind of weekly or, whatever your lymphatic massage therapist tells you, kind of. And then for someone with lipedema, you would start with lymphatic massages?
For sure.
Yeah. Okay.
Yeah, I would start with lymphatic massages to try to kind of decrease the size and get some of that excess fluid out. And then you can go to like either a device treatment or some kind of sculpting treatment, definitely help. Or if you have the money and you just want to go straight to plastic surgery, any of those, options. But like I said, with the place that you looked up, some people still do outpatient, I don't know that device. So it could be definitely beneficial where you're like, hey, I'm getting this fluid out and they're doing that. But then I would still do lymphatic drainage after that treatment.
Yeah. Before and after, I would say, so you can get it moving before you go, and then after to keep it stay on maintenance.
Yeah, for sure. Yeah. You will see the difference. And then once you start working out and back to your running where you can kind of do that, it will help keep it at bay. And that's the thing with the exercise and all that will help keep it down. And then watching your food intake for sure. Gluttony is just not something that
not friendly to the fat
so
deposits.
I think that Steph should come visit her best friend in Charlotte and get some of that.
Right. I think I need to as well.
I mean, we're here. You might as well come on down. You got a place to stay.
Right. So Summer, you want to tell us about the different books that you have and then where people can find you on, I know you have Instagram and that sort of thing. That would be awesome before we kind of wrap things up.
Okay, so yes, so I just started this new platform and it's called Ways to Wellness, WAZE, the number 2 in wellness. And then my new lymphatic drainage book is called Flow and Thrive, How to Boost Your Health with Lymphatic Drainage. It is a guide to kind of help you go over all different aspects of it. I do talk about lipedema versus lymphedema in there. And then in the back, it has a protocol to kind of like a daily and weekly and monthly protocol to kind of help you get to do it yourself and just kind of keep your lymphatic system flowing, along with a journal. There's a journal connected on the back that a lot of times when you do go to doctors, they're confused because sometimes they need to hear something. So I always tell people, write it down. And so you'll have this book where you can actually say, hey, let me write down what happened this day or what day I'm starting to notice it, versus just being like, well, it happened that one day and keep going. But you have something you can actually go back to and then list and say, hey, let me take this book back and go ahead and write everything down. And then you can take it with you and say, on this day at this time, at this happened, and here's what happened. Like the one young lady who had the tattoo, she started noticing within 24 hours that her leg was starting. It was merely her foot and ankle. Like, why am I getting this swelling? She was just thinking, hey, it was just a swelling from the tattoo. But if she didn't really say, write down or kind of remember the journey of what happened, by the time she really found out that it was lymphedema, it had already went up to mid-thigh.
Oh, wow.
Because they were just like, oh, you just probably got some swelling, it'll go down. But you got to pay attention to swelling and how often it happens. So Once again, that's in the Flow and Thrive book. I am starting my own podcast. I'm very small with small subscribers that is at Ways to Wellness, WAZE. The number 2 wellness will be on the YouTube, and then Ways to Wellness on Instagram as well.
Nice.
Okay.
Nice. And if you live in Charlotte, you know, she's
Yeah,
just
Charlotte.
over on Moorhead, so we can you go visit her there.
Yeah, and then my massage business is called My Needs, MYKNEADS, which is where where I actually physically do that work there. So the Ways to Wellness is my educational platform, and then My Needs is actually the business where I do physical work.
Mhm.
Okay.
Well, I really appreciate this, and I'll be seeing you tomorrow. So
Yes, I'm so excited. Thank you guys for having me. This was fun. This is what I want to have happen, is that more people can get education and kind of at least start the conversations with their physicians or their therapists and get better knowledge
Yeah.
on it.
yeah.
And I have a thought. We're going to talk offline about a separate thought that I have, but
Okay.
yes, thank you for all of
Okay.
that information. And is it's got my wheels are turning. Justy already knows. Once you could probably
Yeah.
look in my face and I start getting like thoughts and the two of us get wild ideas sometimes,
Yeah.
but it led us here to this podcast and
That's
here we are.
awesome.
So,
Yes,
Yeah.
that's what it's about, is just kind of helping each other out. And I think it's a good thing. You guys are doing well.
Yeah, we're
Thank you.
trying, and we're trying to just educate people on so many different things. As we're discovering stuff on our health journey, it's like, why not share it? So
Yeah.
I really, really appreciate your time. And Steph and I usually do like a wrap up or something at the end and talk about our self-care, but I think we should not do that today because I'm almost out of battery.
That'll do it.
You got
Our
to plug
self-care, go get a
in.
massage. Yes.
Right.
Okay, okay.
All right. Well, thank
All right.
you. And yeah, we'll see you next time.
All
Okay,
right,
thank
sounds
you.
good. Bye.
Bye.